Our other colleague, Veronica Makhoali, is in Johannesburg, joins me now for more reaction. Afternoon, Veronica, thanks very much for your time. I mean, the NHI is about doing away with inequalities that we're seeing in the system at the moment, the fragmentation that the president spoke about, and his minister adding to that, it is about nothing else but universal access. Now, you spent your day traveling or visiting facilities that belong to both the public and the private health care. What did you see? Let's start with Tembisa Hospital, which you visited first. What did you see there?
Well, at Tembisa Hospital, we really got a sense from some of the residents that they would welcome most definitely what the NHI seeks to provide for residents. But realistically, the sense that we got from the residents there was that there was a lack of understanding essentially of what the bill is, what it covers, and how the implementation will look for the residents of Tembisa. Some of them actually were even shocked to find out that the president was putting this bill, this act into law today, signing it off. And we also did get a sense from the residents in Tembisa that they would welcome this given the fact of the pressures that faces hospitals like Tembisa Hospital, but the issue of corruption, the issue of how do we ensure the procurement of that money, how do we ensure that what the money from the NHI fund is actually set out to do will actually, provide that kind of assistance to residents. We know that hospitals like Tembisa have been marred by, controversies in regards to allegations of corruption, a 1.2 billion rand amount of money in a procurement scandal that till this day we still have no answers to. But we moved on, of course, to other facilities in the private sector where we spoke to residents in Randburg, and they essentially spoke about the fact that given the president's, somewhat fanfare around the NHI bill, there is a lot of expectancy from the government to ensure that this goes through in the way that they, of course, desire. Let's have a listen.
I do get that they want us to have equal access to all facilities within the healthcare system. Even though our healthcare system is struggling, I think it would have been better if they worked on our government institutions, like our public healthcare institutions first before implementing this.
Okay, I think it's a great idea because now it'll make it more even between the poor and the rich. It's more for the poor because I've been coming to the clinic for many years down here and I see that the people do need it. So it'll take many years to come into full effect, and so I agree with the president that it is good for South Africa.
I think actually it's going to help a lot of people. It's going to be fair on more of them, and it's going to add more of equality on people.
The NHI in its present form, I don't think should give any South African citizen cause for concern who is able to access private healthcare. For the large majority who are not able to access private healthcare, it's obviously hope for them, but I think it's false hope because there are just too many hoops that need to be jumped through before it's made effective. So for those who are concerned, I don't think it's necessary at this stage. Maybe in a year or two's time we can revisit this, but at the moment, definitely not.
Well, contrary to most signing of bills, which are often, attached with an unceremonious media statement and little fanfare, the president made a statement today to pick a date, a time, and to ensure South Africans that the NHI bill is something that will work for the country and, of course, creating that equal access to healthcare. But for some residents, mixed reaction. Back to you in studio.